cardiologist warns this pill is damaging the hearts of older adults. BISP Senior Health Tips, Easy Humanly English, Humanly Good English. As the years accumulate and wisdom blossoms, protecting the very core of our being, our heart, undeniably becomes a paramount concern. It's a natural shift in focus, a recognition of our body's changing needs. Yet, what if the most significant threat to your cardiac health isn't lurking in the usual suspects like your dietary choices, the relentless pressures of daily stress, or even the genetic predispositions passed down through your family lineage? What if, instead, this subtle but potent danger resides quietly, almost innocently, within the familiar confines of your own medicine cabinet, overlooked day after day? Today, a new and urgent message is being amplified by leading cardiologists across the globe, sounding a vital alarm. This warning isn't centered on obscure, rare medical conditions, nor is it about complex, invasive surgical procedures that grab headlines. Instead, it directs our attention to a far more common and pervasive concern: the everyday pills many older adults routinely consume, often without a full grasp of the silent risks they might pose to their cardiovascular system. We are delving into a crucial conversation about medications that have been thoroughly reviewed and given the green light by regulatory bodies like the FDA, widely prescribed by trusted doctors, and integrated into the daily routines of millions. However, the crucial nuance lies in the context of an aging body. As our physiological landscape evolves with time, these seemingly benign medications can, in fact, quietly but persistently escalate your vulnerability to serious heart-related health challenges. This includes an increased propensity for heart failure, the looming shadow of a stroke, or the terrifying suddenness of a cardiac event. And perhaps the most unsettling aspect of this entire scenario is the stark reality that the vast majority of seniors navigating these daily prescriptions are never adequately informed or warned about these potential dangers. Prescriptions often fall into an automatic renewal cycle, continuing for years without critical reassessment. The subtle onset of side effects is frequently misattributed to the inevitable march of time, dismissed simply as just getting older. And critically, the perilous interactions and dangerous combinations of multiple medications are, far too frequently, overlooked or misunderstood by both patients and, sometimes, even by healthcare providers. But the tide of this silent misunderstanding begins to turn now. This comprehensive discussion aims to shed light on this critical issue, meticulously counting down 5 specific categories of pills that hold the potential to inflict damage upon the hearts of older adults, particularly those who have gracefully surpassed the age of 60. Some of these medications may be instantly recognizable to you, perhaps even a part of your daily regimen. Others might come as a genuine surprise, challenging long-held assumptions about their safety and efficacy in later life. But one truth unites them all. Every single one of these medications warrants a diligent second look, a thorough re-evaluation in the context of your unique health profile and the nuances of aging. This is not about instilling fear or panic. On the contrary, it is about empowering you with unvarnished facts, meticulously substantiated by rigorous scientific research, endorsed by respected medical experts, and presented in the clearest, most approachable, easy humanly English possible. If you are an individual over the age of 60, or if you are a devoted caregiver who cherishes and supports someone in that age demographic, it is imperative that you lend your closest attention to the information that follows. What you are about to discover has the profound potential to safeguard not only your heart health, but also to preserve your precious independence and quite possibly even extend the very span of your life. Let us embark on this enlightening journey, beginning with our 5th critical consideration. Number 5. Ibuprofen and NSAIDs, the hidden strain on aging hearts. We start our vital countdown with a category of medication so ubiquitous, so deeply ingrained in our everyday lives, that it can be found in almost every household across the nation. It is a group of over-the-counter mainstays that, despite their familiarity, may be subtly and persistently amplifying your risk of developing heart failure, contributing to persistent fatigue and causing long-term, insidious cardiovascular damage. We are, of course, referring to ibuprofen and the broader class of non-steroidal anti-inflammatory drugs, or NSAIDs. Think of names like naproxen, diclofenac, and naturally ibuprofen itself. These common painkillers enjoy a reputation for being trusted, familiar, and remarkably easy to acquire. When the discomfort of arthritis flares, when an aching back becomes unbearable, or when a persistent headache demands relief, the vast majority of people reach for one of these pills without a second thought, assuming them to be completely harmless. This reflexive action is understandable, given their widespread availability and historical perception. However, once an individual has reached the age of 60, these very same common pills can quietly, almost imperceptibly, transform into a serious and often underestimated risk to the delicate mechanics of the heart. NSAIDs perform their primary function by reducing pain and inflammation, a welcome relief for countless individuals. However, their pharmacological reach extends beyond mere pain relief. They exert a significant influence on how your kidneys meticulously regulate the delicate balance of salt and water within your body. In younger adults, the robust physiological systems of the body typically possess the resilience and adaptive capacity to adjust to these effects without significant adverse outcomes. But with the natural progression of age, kidney function undergoes an inevitable and gradual decline. This physiological shift occurs even when routine lab results may appear within normal ranges, masking a subtle but critical reduction in efficiency. This age-related decline means that your body may increasingly struggle to expel excess fluid, leading to its unwelcome retention. You might begin to notice telltale signs, your ankles swelling noticeably, your favorite shoes suddenly feeling uncomfortably tight, or a pervasive heavy sensation developing in your legs by the end of the day. A general increase in fatigue, a feeling of being unusually tired, might also become a more frequent companion. These symptoms are, regrettably, all too often attributed to the unavoidable process of aging itself, casually dismissed as simply part of getting older. Yet, in a considerable number of instances, these seemingly minor discomforts are, in fact, crucial warning signs, gentle nudges from your body signaling a deeper underlying issue. The retention of this excess fluid places a substantial and undesirable increase in workload on your heart. For older adults, particularly those who are already managing high blood pressure or have a documented history of heart disease, this added pressure can cascade into a perilous cycle, potentially leading to the worsening of existing heart failure or precipitating dangerous and erratic fluctuations in blood pressure. But the spectrum of risk associated with NSAIDs does not conclude there. These medications also possess the capacity to diminish blood flow to the kidneys, a detrimental effect that further compromises and weakens their function over an extended period. Over time, consistent NSAID use has been directly correlated with elevated blood pressure readings, a heightened risk of kidney damage, and even an increased likelihood of experiencing a heart attack or stroke. The insidious nature of these risks is magnified by the duration of their use. The longer you continue to take them, the more these individual risks accumulate and compound, creating a progressively more precarious situation for your cardiovascular and renal systems. Even short-term use, especially when combined with other commonly prescribed medications such as diuretics, often referred to as water pills, or ACE inhibitors, a class of blood pressure medications, can create a particularly dangerous trio. This combination can severely impair kidney function and dramatically intensify the strain placed upon the heart, making an already vulnerable system even more susceptible to damage. What renders this situation particularly perilous is the subtle, almost imperceptible way these effects unfold. You won't consciously feel your kidneys struggling under duress. You won't perceive your heart laboring harder with each beat. The symptoms are quiet, insidious, mild swelling that you might rationalize away, a lingering fatigue that you attribute to a busy day, or occasional dizziness that seems fleeting and insignificant. These signs are deceptively easy to dismiss, chalked up to the inevitable process of growing older. Furthermore, because NSAIDs are readily available over the counter, they carry an implicit air of safety and often don't seem like serious medications requiring careful consideration. But it is precisely this perceived harmlessness and accessibility that makes them so extraordinarily risky for an aging population. If you find yourself regularly reaching for NSAIDs and you are over the age of 60, it is not merely advisable but absolutely imperative to initiate a candid and thorough discussion with your doctor. The central question to pose is whether these medications truly remain the most appropriate and safest choice for your current health status. You may not necessarily need to cease their use entirely, but transitioning from daily consumption to occasional use, only when absolutely necessary, can yield a profound and protective difference for your heart and kidneys. Depending on your specific pain management needs and medical history, your healthcare provider can guide you towards safer alternatives. These might include acetaminophen for certain types of pain that do not involve significant inflammation, or topical pain relief treatments that deliver medication directly to the affected area without systemically impacting the heart or kidneys. Beyond pharmaceutical options, a holistic approach incorporating lifestyle adjustments can be remarkably effective in managing chronic discomfort. This could involve integrating regular stretching routines into your day, utilizing heat therapy to relax muscles and ease stiffness, or engaging in physical therapy tailored to address underlying musculoskeletal issues. The overarching objective is never to force you to endure pain in silence. Rather, it is to provide effective pain relief without inadvertently creating larger, more complex health problems down the line. Because for older adults, NSAIDs, despite their innocuous appearance, may be quietly and steadily jeopardizing the very health of your heart. Number 4, benzodiazepines, the sleep aid that can steal your stability. Moving on to our fourth crucial category, we shift our focus away from pain relief. This next group of medications is not designed for joint discomfort or an aching back. Instead, it encompasses substances frequently prescribed with the benevolent intention of helping you achieve elusive sleep or to quell the relentless churn of anxious thoughts. Yet, for older adults, these very prescriptions may be subtly, yet relentlessly, eroding your cognitive clarity, undermining your physical balance, and incrementally diminishing your precious independence. We are discussing benzodiazepines. If you have ever grappled with the frustrating struggle of falling asleep, the vexing challenge of staying asleep through the night, or the overwhelming experience of racing, uncontrollable thoughts that refuse to quiet down, there's a significant chance your doctor may have prescribed you a medication from this class. Familiar names like lorazepam, temazepam, or diazepam often come to mind. These medications are members of the benzodiazepine class, and for a multitude of older adults, they can initially feel nothing short of a lifesaver, offering a much-needed reprieve. They present themselves as that much-desired pill that ushers in a night of uninterrupted sleep, that takes the sharp edge off pervasive anxiety, or that simply helps you regain a sense of normalcy and calm amidst a chaotic mind. But what if this very same pill, embraced as a beacon of relief, was also, unbeknownst to you, quietly escalating your vulnerability to debilitating falls, fostering pervasive confusion, or even contributing to a more severe and insidious long-term cognitive decline? Benzodiazepines exert their effects by acting on the central nervous system, specifically by enhancing the activity of a neurotransmitter called GABA, which in turn slows down overall brain and nervous system activity. This is precisely why they are so effective at inducing feelings of calm, promoting sleepiness, and alleviating anxiety. However, in the aging brain, this same mechanism can, unfortunately, overshoot its mark. These medications do not simply induce a gentle relaxation of your mental faculties. Their sedative properties also significantly impede crucial functions such as reaction time, fine motor control, and overall balance. This potent combination of impaired cognitive and motor functions dramatically increases the risk of falls. a hazard that becomes particularly pronounced during the nighttime hours when grogginess from the medication is typically at its peak. It is vital to understand that falls in this demographic are far from minor incidents. They represent one of the leading causes of severe injury, necessitate costly and prolonged hospitalizations, and tragically often lead to a devastating loss of independence among seniors. But the inherent danger of benzodiazepines delves even deeper than the immediate threat of falls. These medications are also significantly linked to the development of troubling memory issues, a persistent mental fog that obscures clear thought, and, disturbingly, even a higher long-term risk of dementia when their use extends over prolonged periods. What frequently begins as a mild degree of forgetfulness or a subtle difficulty in concentrating can gradually progress, worsening over time, and tragically, most individuals never manage to connect these cognitive declines back to the daily medication they are consuming. Then, there is the profound issue of dependence. The body possesses a remarkable adaptive capacity, and it adjusts to the presence of benzodiazepines over time, developing a tolerance. This often means that an individual may require an ever-increasing dose to achieve the same initial therapeutic effect, creating a treacherous escalation. Furthermore, attempting to abruptly discontinue these medications can trigger a severe and distressing withdrawal syndrome, characterized by heightened anxiety, profound insomnia, debilitating restlessness, or even involuntary tremors. It becomes a deeply entrenched cycle. You feel compelled to take the pill to achieve sleep, yet that very same pill may be systematically and slowly eroding the mental clarity and physical stability that healthy sleep is fundamentally designed to support and restore. So, in light of this critical information, what course of action should you pursue? The foremost piece of advice is, do not panic. And under no circumstances should you suddenly cease taking the medication without medical guidance. An abrupt discontinuation of benzodiazepines can precipitate dangerous withdrawal symptoms. Instead, if you are currently taking a benzodiazepine, the most responsible and imperative step is to schedule an immediate and frank discussion with your doctor. They are equipped to offer guidance, which may include a slow, carefully supervised tapering, scheduled to gradually reduce the dosage, or to explore safer, non-benzodiazepine alternatives that do not carry the same spectrum of risks. It is empowering to realize that effective non-drug therapies exist and can be highly successful. Cognitive behavioral therapy for insomnia, CBTI, stands out as one of the most rigorously researched and effective treatments for chronic sleep disturbances, and notably, it achieves its results without any of the undesirable side effects associated with pharmaceutical interventions. For the management of anxiety, a range of holistic approaches can prove immensely beneficial. These include practicing mindfulness techniques, incorporating structured breathing exercises into your daily routine, engaging in light but consistent physical exercise, or even exploring certain types of antidepressants that can alleviate anxiety without posing the same risks to balance or memory. The core insight here is a profound one. Not every instance of difficulty sleeping or confronting anxious thoughts necessitates a sedative. Especially for older adults, what initially appears to be a small, innocuous dose of relief can, over time, accumulate into a profoundly high cost, silently eroding vital aspects of their well-being. Because that seemingly small white pill that so reliably helps you drift off into slumber might also be quietly, insidiously pulling away your physical balance, your mental awareness, and ultimately, your cherished independence. Number 3. Proton pump inhibitors. The silent drain on your heart and body. Now, let us turn our attention to the third medication category on our list, a group of pills taken by literally millions of seniors as a common remedy for the discomfort of heartburn and acid reflux. However, this widely used class of drugs may be stealthily weakening your bones, systematically draining your body of essential nutrients, and more disturbingly, raising new and significant health risks about which you have likely never received a warning. We are talking about proton pump inhibitors, or PPIs, the silent drain on your heart and entire physiological system. The familiar burning sensation in the chest, the unpleasant sour taste of acid reflux, and the general discomfort of indigestion are conditions that, unfortunately, tend to become more prevalent and bothersome as we progress through life. For a great many individuals suffering from these gastrointestinal woes, the seemingly perfect solution arrives in the unassuming form of a small pill. You might recognize brand names containing active ingredients such as omeprazole, pantoprazole, or esomeprazole. These are the ubiquitous proton pump inhibitors. The mechanism by which these medications work is elegantly simple yet profoundly impactful. They effectively reduce the production of stomach acid. And for those seeking rapid, short-term relief, their effects can indeed feel nothing short of miraculous. The agonizing burning in the chest subsides, the unpleasant sour taste vanishes, and the post-meal pain that once marred every eating experience disappears. It seems like a perfectly straightforward solution, just one pill a day, and the persistent discomfort recedes into memory. But here lies the critical piece of information that most people, including many long-term users, never adequately hear or understand. These powerful acid-reducing pills were fundamentally never designed or intended for indefinite long-term use, particularly not in the context of an aging body. Yet, a staggering number of seniors, millions of them, continue to take PPIs on a daily basis for months, and often for years on end, without ever pausing to re-evaluate whether the original need for the medication still truly exists. Over an extended period, this quiet, unexamined routine can lead to a cascade of serious health consequences, some of which directly and detrimentally impact the health of your heart, the structural integrity of your bones, and your overall physical strength and vitality. One of the most frequently overlooked yet profoundly impactful effects of long-term PPI use is their insidious interference with nutrient absorption. Stomach acid, often perceived solely as a source of discomfort, plays a far more critical and beneficial role in your digestive system than simply causing heartburn. It is an absolutely essential component in helping your body efficiently absorb key minerals, including the vital trio of calcium, magnesium, and iron, along with other essential nutrients like vitamin B12. When the levels of stomach acid are suppressed too profoundly and for an excessively long duration, these crucial nutrients are simply not absorbed by the body in the efficient manner they require. The ramifications of this malabsorption are significant. Chronically low calcium levels directly translate into weakened bones. For older adults, this unwelcome reduction in bone density dramatically increases the risk of fractures, particularly devastating hip fractures, which can be life-altering events, profoundly impacting mobility and independence. And the detrimental effects do not stop with bone health. Magnesium deficiency, which is notably more prevalent among long-term PPI users, can have a direct and alarming impact on your heart rhythm, potentially leading to arrhythmias. It can also manifest as debilitating muscle, cramps, or even result in persistent dizziness and fatigue, further compromising stability and energy levels. Deficiencies in iron and vitamin B12 can precipitate anemia, lead to distressing nerve problems, or manifest as a pervasive mental fog and cognitive dullness. All of these issues can, tragically, be mistaken for the natural signs of aging, delaying appropriate diagnosis and intervention, when in reality, they are often directly attributable to medication-related side effects. Furthermore, consider the critical role of your immune system. Stomach acid acts as a crucial first line of defense, a robust barrier designed to protect your body from the invasion of harmful bacteria and other pathogens that enter through the oral cavity. When this protective acid barrier is significantly lowered for an extended period, your body becomes far more vulnerable to opportunistic infections. This is particularly true for infections like Clostridium difficile or C. diff, a severe gut infection that can cause debilitating diarrhea and dangerous dehydration, especially in the already vulnerable population of older adults. Some scientific studies have even begun to link long-term PPI use to higher risks of kidney disease, an accelerated rate of cognitive decline leading to dementia, and various cardiovascular problems, though research in these specific areas is still actively ongoing and requires further confirmation. Nevertheless, a clear and concerning pattern is emerging. The longer these medications are taken without a thorough and critical review of their ongoing necessity, the more the cumulative risks begin to decisively outweigh the original benefits they provided. This profound insight is not intended to label PPIs as inherently bad medications. Indeed, they are remarkably effective and, in many specific clinical scenarios, absolutely necessary. They play a vital role in the management of active ulcers, severe esophagitis, or certain other specific stomach conditions where robust acid suppression is medically indicated. The core problem, however, arises when what should fundamentally be a temporary targeted treatment morphs into a permanent, unexamined habit. If you have been taking a PPI for a duration exceeding a few months, it is not just recommended, but truly essential to initiate a thoughtful conversation with your doctor. You may indeed still require it for a valid medical reason, or conversely, you may discover that the original condition has resolved or can be managed through alternative means. Some individuals can successfully transition to lower doses, opt to take the medication only when their symptoms acutely flare up, or, under careful medical supervision, gradually taper off the medication entirely. Because sometimes the immediate relief afforded today should not and need not come at the profound cost of your fundamental strength, your essential balance, and your overall resilience in the years to come. Number 2, heart and blood pressure medications, when the cure becomes the risk. Let us now progress to the penultimate item on our critical list, number 2. This category focuses on medications that are fundamentally designed and prescribed with the explicit purpose of safeguarding your heart, yet under certain circumstances, specifically in the wrong dosage, or when combined imprudently with other drugs. These very same medications can, ironically, place your heart in significant and unforeseen danger. We are addressing heart and blood pressure medications, a paradoxical scenario where the intended cure itself can evolve into an unexpected risk. When the conversation naturally turns to medications that have the potential to damage the heart, blood pressure pills typically do not immediately spring to mind. In fact, their entire pharmacological purpose is precisely the opposite. They are prescribed with the intent to protect the heart, to lower the excessive pressure within the circulatory system, to reduce the overall strain on the cardiac muscle, and to facilitate the heart's ability to perform its vital pumping function more efficiently. For millions of older adults, these medications are not merely helpful, they are absolutely essential, forming the bedrock of their cardiovascular health management. However, here lies an uncomfortable yet critically important truth. The very medications meticulously prescribed to protect your heart can, under specific conditions, also simultaneously place it at considerable risk. This risk becomes particularly salient if the prescribed dose is excessively strong, if the combination of multiple medications becomes overly complex and synergistic in detrimental ways, or if your body's physiological landscape has undergone significant changes since the initial prescription was originally written, rendering the old regimen potentially inappropriate. Let's dissect this further by looking at specific classes of these medications. We begin with diuretics, widely known as water pills. These medications function by assisting the body in expelling surplus fluid and salt, effectively reducing overall blood volume. They are commonly employed in the treatment of both high blood pressure and heart failure. However, in the delicate physiological context of older adults, their potent effects can lead to a cascade of adverse outcomes. These include significant dehydration, dangerously low levels of potassium, hypokalemia, an imbalance in sodium levels, hyponatremia, and pervasive dizziness. That familiar, tiring, lightheaded sensation you experience when transitioning quickly from sitting or lying down to a standing position. It may not simply be a sign of aging. It could, in fact, be your water pill drawing an excessive amount of fluid and electrolytes from your system, causing a temporary but risky drop in blood pressure upon standing. Next, consider calcium channel blockers, another frequently prescribed class of cardiovascular medication. These drugs work by relaxing the muscles in the walls of your blood vessels, which in turn widens them and reduces overall pressure. While effective for many, in some seniors, they can trigger uncomfortable swelling in the legs and ankles, slow the heart rate excessively, a condition known as bradycardia, or contribute to persistent fatigue and an unsettling brain fog. Beta blockers, yet another common and powerful class of heart medication, can be equally intricate and challenging to manage in older individuals. Their primary action involves slowing the heart rate, which is undoubtedly beneficial in many cardiac conditions. However, sometimes this slowing effect can become too pronounced, leading to adverse symptoms. This might manifest as bothersome shortness of breath, persistently cold extremities, and a marked reduction in exercise tolerance, limiting physical activity. Furthermore, in individuals with diabetes, beta blockers can dangerously mask the typical warning signs of low blood sugar, hypoglycemia, transforming a potentially manageable dip into a hidden and far more perilous medical emergency. The undeniable truth is that the human body undergoes profound and dynamic changes with the inevitable march of age. Blood vessels, once pliant, tend to stiffen. The kidneys, once highly efficient filters, process substances more slowly and less effectively. The intricate way your body regulates salt, water, and blood pressure shifts dramatically over the decades. This fundamental physiological evolution means that a medication dose that was perfectly efficacious and safe for you at the age of 55 may now, at 75, be excessively potent and detrimental. And the complexity is not limited to the impact of a single pill. A substantial number of older adults are, quite understandably, prescribed multiple heart medications simultaneously. This could involve a beta blocker, a diuretic, a medication to regulate heart rhythm, and another to manage cholesterol levels. The combined effect of such a complex pharmacological cocktail can quietly, insidiously overwhelm the body's adaptive capacities. This phenomenon is clinically termed polypharmacy, and it is an incredibly pervasive and concerning issue among seniors. It often initiates a cascading cycle. One medication is prescribed and then another is added to counteract an unpleasant side effect of the first. Before long, the body finds itself meticulously juggling 6, 7, or even more prescriptions concurrently. You might begin to feel generally off, a pervasive fogginess, an unexplained weakness, or a disconcerting lack of steadiness on your feet. It is an all too common tendency to attribute these burgeoning symptoms to the natural, unavoidable process of aging. However, in a significant number of these cases, these unsettling symptoms are not a reflection of age itself, but rather a direct consequence of medication overload, a complex interplay of drugs, creating systemic imbalance. And when essential heart medications begin to interfere with critical functions like balance, kidney performance, or overall energy levels, the risk of hospitalization alarmingly increases. This hospitalization, ironically, is often not due to the underlying heart condition itself, but rather a direct consequence of the way that condition is being treated with an overly aggressive or incompatible medication regimen. To be abundantly clear, it is crucial to reiterate that these medications, when prescribed and managed appropriately, can be genuinely life-saving interventions. They play an indispensable role in preventing catastrophic cardiac events and managing chronic conditions. However, their efficacy and safety are contingent upon regular, critical re-evaluation, not merely automatic renewal driven by habit. The primary objective should not be narrowly focused on simply controlling numbers on a medical chart. The real human-centric goal is to empower you to maintain your mental sharpness, your physical steadiness, your valuable mobility, and your cherished independence for as long as possible. If you, or a loved one dear to you, are over the age of 60 and currently taking multiple medications for blood pressure or heart disease, it is imperative to initiate a proactive dialogue. Ask the probing, essential questions. Are these specific doses still appropriate for my current age and health status? Are these medications truly working synergistically together, or are they inadvertently working at cross purposes, undermining each other's effects or generating new problems? Because while the correct heart medication can undeniably save your life, the wrong combination or an outdated regimen possesses the capacity to quietly, incrementally steal it, piece by precious piece. Number 1, polypharmacy, the most dangerous pill, is all of them. We arrive now at the pinnacle of our critical countdown, at number 1, the most dangerous pill of all. Its danger does not stem from its individual composition or its specific pharmacological action, but rather from a phenomenon that transcends any single drug. It is dangerous precisely because of the sheer quantity of medications you might be taking concurrently. Our number 1, polypharmacy, reveals that the most dangerous pill is, in essence, all of them collectively. If there is a single overriding factor that poses the greatest and most insidious risk to the health and well-being of older adults, it is not a singular pill at all, but rather the cumulative effect of multiple medications taken together. Polypharmacy, defined clinically as the regular use of 5 or more different medications at once, has tragically emerged as one of the most significant yet frequently overlooked and underappreciated threats to senior health and overall quality of life. And what makes this revelation even more alarming is its shockingly widespread prevalence. In fact, numerous robust studies consistently indicate that nearly half of all adults over the age of 65 are regularly consuming 5 or more medications every single day. A substantial segment of this population takes even more, sometimes juggling 10, 12, or even 15 different prescriptions. Consider the typical scenario: a pill for managing blood pressure, another for regulating cholesterol levels, something to aid in sleep, a medication to alleviate persistent pain, an acid reducer for stomach discomfort, a vitamin supplement, and perhaps even a mood stabilizer. This often initiates a subtle, yet relentless cascade where one medication is introduced, leading to the addition of another and then another, until the body finds itself grappling with a highly complex and intricate mix of drugs. Crucially, these specific combinations were never rigorously tested together in clinical trials, and certainly not within the unique and often more fragile physiological context of aging systems. And here lies yet another profound truth that most people, including many healthcare providers, never adequately convey or fully comprehend. Every single new medication introduced into a patient's regimen incrementally increases the probability of experiencing adverse side effects. Furthermore, every additional combination of drugs dramatically elevates the risk of harmful interactions, some of which can be life-threatening. With each extra pill, the vital organs responsible for processing and eliminating these substances, particularly your kidneys, your liver, and your heart, are subjected to an ever-increasing burden, struggling to keep pace with the complex pharmacological demands placed upon them. The effects of polypharmacy are not always dramatic or acutely alarming. They are often subtle, insidious, and gradually unfolding. You might begin to experience a more profound and persistent sense of tiredness or fatigue. Your gait may become less steady, increasing your susceptibility to falls. You might notice yourself forgetting things more frequently, experiencing a subtle but concerning decline in cognitive function. Your digestion may become sluggish and problematic. Your mood might undergo unexplained shifts or become more volatile. In the absence of clear information, the natural inclination for most individuals, and even for their families and some clinicians, is to assume that these burgeoning symptoms are simply an unavoidable and intrinsic part of the aging process itself. But sometimes, often, it is not age that is the primary culprit. It is the complex, cumulative burden of the pills. And perhaps the most troubling aspect of this entire phenomenon is the stark reality that a significant number of these ongoing prescriptions are, in fact, no longer genuinely needed. They may have been originally prescribed many months or even years ago for conditions that have since resolved, changed, or been adequately managed by other means, yet they have never undergone a thorough re-evaluation by a medical professional. Sometimes the original condition for which the medication was prescribed has genuinely changed or abated. In other scenarios, the the distressing side effect of one particular drug is being inadvertently treated with the introduction of yet another new drug, creating a vicious and self-perpetuating cycle known as the prescribing cascade. This insidious process creates a quiet, downward spiral, not towards better health and vitality, but rather into a state of chronic fatigue, increasing physical frailty, and an escalating dependence on medications that may ultimately do more harm than good. Polypharmacy doesn't merely impose an immense strain on your heart and other vital organs. It possesses the chilling capacity to systematically erode your mental clarity, sap your vital energy, and ultimately dismantle your cherished independence. The powerful solution to this pervasive and complex problem is not to impulsively cease all medications without guidance. Such a drastic action can be dangerous and is strongly discouraged. Rather, the prudent and effective solution lies in a comprehensive and critical review of everything you are taking. A skilled and experienced doctor, or even more specifically, a clinical pharmacist specializing in medication management, can be an invaluable ally in this process. They can meticulously help you navigate your entire medication list, systematically identify outdated prescriptions that are no longer serving a purpose, judiciously reduce what has become unnecessary, and carefully adjust the dosages and combinations of medications that are still genuinely needed for your ongoing health. The positive results and transformations from such a thorough medication review can be truly life-changing. Patients often report less dizziness and a newfound stability, a significant resurgence of energy, improved focus and concentration, a clearer and sharper mind, a marked reduction in falls, fewer distressing visits to the hospital, and perhaps most profoundly, the joyous sensation of feeling like themselves again, perhaps for the first time in many years. Because true health and well-being are not always about indiscriminately adding more pharmaceutical interventions. Sometimes the most profound improvements in health are achieved by judiciously letting go of what is no longer serving your best interests. If you or a loved one who is important to you is currently taking 5 or more medications, please do not delay. Schedule a comprehensive medication review with your doctor or pharmacist without hesitation. Be empowered to ask the difficult but essential questions about each and every pill. And critically, never be afraid to advocate passionately for yourself and for your own health, because the most dangerous pill in your regimen might very well be the one you didn't even realize you were still taking, quietly undermining your health day by day.